So, good morning, everyone.
Good morning.
Let's get awake. It's not morning. It's not Monday as the last time. It's Tuesday. So I hope you already get accustomed that the working week is already on, and you get accustomed to that, and we can enjoy today's discussion. Today. I'm happy that our invitation accepted Dan Schwarz,
Hello, everyone.
Thank you, Dan, that you join us. Today it might be a bit personal because Dan is a long-time friend of mine. We've met years ago when I did a sortie after my PhD internship in Utrecht. And where I found out what kind of cooperation I need to be able to study brain from the images of magnetic resonance. So I went to give a talk in Brno University of Technology to invite someone who might be interested in cooperation with the medical field, and there was Dan, and it seems that it started to interest Dan, and we started a very, very, very fruitful cooperation. So therefore, maybe a bit sentimental approach to this discussion. Well, we have the luck to have a man of many faces here. Iron Man, musician, researcher, supervisor, innovator in medical education, and entrepreneur. So there's a lot.
Wine producer.
Sorry?
Wine producer.
Wine producer, yeah. Never tasted. He's so humble, so never offered. Okay, so I actually don't know where to start. So perhaps Dan, could you introduce yourself and tell us what's your story?
Okay. So
what drives you to?
So once again, good morning. It's a pleasure for being here. And yeah, if I shall say something about my journey, so I studied biomedical engineering. This is my background. I graduated from Brno Technology of University as an engineer. Later, I also completed the doctoral studies there. My PhD thesis was on registration of medical images, and at the very late stage of my PhD studies, I was looking for some practical application, and that was the time which Tomáš mentioned that we met, and since then we have been cooperating until now. So the main focus of the research was always medical image analysis, medical image processing, but thanks to this cooperation, I was always applying this into the field of neuroscience and particularly to psychiatry. And after my graduation and then after my PhD, which was around 2005, I was already also working in industry because I was always splitting my studies with some kind of jobs. So I was working for some small IT company in Brno, and in 2005, I applied for a job at Masaryk University. There was a job open at that time. It was a Center of Biostatistics and Analysis, which the center was in between of Faculty of Science and Faculty of Medicine. And I got the position and work mainly on projects focused on technology and enhanced learning. So we were trying to get projects and implement projects for faculty development in terms of teaching. And in parallel, I was also doing some kind of my teaching. I was a lecturer in some subjects in computational biology or mathematical biology at the Faculty of Science, so it was not medicine in the time. Later, 10 years ago, 2014, we founded a spin-off company. It was one of the first Masaryk University spin-off companies in the time, Institute of Biostatistics and Analysis, with some share of Masaryk University, and this company is still working, and I'm one of the shareholders and also one of the directors there now. And in terms of academia, I switched to Department of Simulation Medicine 2 years ago. So my whole career here at Faculty of Medicine is at the Simulation Center and the Department of Simulation Medicine. Is that enough for a start?
It's too much. I don't know where to go now, because there's a lot of...
Maybe one remark, because I felt a little bit humble when you were starting. I'm not a wine producer. I'm just helping my partner, my life partner, to grow some wine. But my help is very limited, and she is the wine producer.
Okay. And the brand is?
The brand is Starčari. There is a small vineyard on the northeast part of Brno, and we have a very small one. Yeah. So it's a hobby.
Okay, okay.
It's not a professional part of mine.
Yeah, Dan, you were able to bridge many fields and many areas. So, what helped you to do that? What's necessary to be able to start from the point of the technology side and start to work with the medicine part and medicine field, and what was something that really made it work for you?
Yeah, so I think that I was always trying to be explorative, so I wanted to explore new things. So when I saw at the Brno Technology of University that there is a field of biomedical engineering, it wasn't my choice from the start. So when I saw there is a possibility to bridge between medicine and engineering, I tried it. I liked it. So whenever I see an opportunity to try something new, I'm trying. So this is probably a helpful thing. And then you need some skills and devotion to also maintain some, at least for some reasonable period of time, some efforts to achieve also something. So, and this is, maybe I would call it endurance, and this is also something from the sport kind of my life.
It wasn't so, let's say, usual that the research teams were, let's say, from multi fields. And when I mentioned Utrecht, it was something that was a usual thing to bring people from different fields to collaborate, to work on a similar project from different perspectives. I know that you were there as well, so could you comment on your experience in such a lab?
Yeah, Utrecht was a very good part of my life, also, although very short. So yes, I went there because...
You were there about half a year? 6 months?
Less. I think it was around 3 months only, but later we met many times with the researchers there, just at the conferences, so the connections remained. In the time it was an internship. I went there based on your recommendation. Yes, there were interdisciplinary teams. It was first time I saw that in neuroscience there are PhD students with backgrounds in social sciences, and all of us could cooperate in one general topic, which is brain research. So that was very enlightening, and Utrecht, I think, is a very good place for making research and for making internships, because later I sent there also my PhD students, and they always returned enlightened and very, I would say, it was fruitful and reasonable part of their studies.
What I really admired there was that there were people from, as you said, social sciences, people from mathematics field or physics field, and they really had huge insights into the neurobiology. So they were able to really internalize both fields, and that was something that was really striking, and I can say that you achieved that as well. So,
yeah, and this is also why I like neuroscience as a field of research, because it's, I think, one of the most interdisciplinary fields you can see at the conferences. You can see people from all sciences working on the brain research.
Yeah. So. Just to advertise that we in the med school just started the master's degree in neurosciences. So, and this is really conceptualized as an interdisciplinary study program. So everyone is invited to share the news, and we are
and get a degree.
Get the degree, and we are looking for new students in this program. Well, so this is your research field, and it is about medical images and analysis of medical images. This is a field that really lives through a kind of revolution when something like artificial intelligence entered the field. So do you see that the artificial intelligence will solve all the riddles that we were working on, or is just a tool that could solve a part of it, but there's still a room for us?
Yeah. We are now experiencing the revolution of AI being everywhere in terms of neuroscience or in terms of our work. We have been using machine learning, which is also part of artificial intelligence, since nearly the start of our cooperation. So in that time, around 2010, 2012, we just had some, let's say, limitations of the hardware, limitations in terms of the amount of data. Anyway, the concepts are still the same. You can have either the machine learning kind of artificial intelligence, but now what makes today's hype is the generative AI, which we are, however, not using. If we are not correcting our texts in the manuscripts, we are still trying to use still the same machine learning. So I don't think that it will solve everything, because if it hasn't solved it until now, it will probably not solve it later without other progress in other fields. So where I see the biggest challenge also for the AI is we have to shift, or someone has to make a shift in terms of the physical measurements, because we have the AI, we have many methods of data analysis, but we lack a spatial resolution, time resolution in those images. So sometimes we make mistakes exploring the data, looking for something which is not there. So what we need to achieve, I mean, the society, is to get some new Nobelists, but not in AI, but rather in the physical measurements, and then we can apply the AI on the new qualities in the data and get some new information, new knowledge. But so this is where I see now the AI may struggle, because what we are looking into the data, it's not there, probably. This is my viewpoint.
Actually, there's a fear among clinicians, radiologists, that that AI will step in and take their jobs, and that it can identify lesions in the medical images. So do you think that this is closer than, I mean, we are talking about research of schizophrenia, where it's all the difficulties about the resolutions are applied, but let's say in the clinical realm, do you think that this is a different story?
No, I think it's relevant. There are now certified medical devices which somehow stepped into the radiology and help radiologists to overcome their limitations. And I think these limitations are inherent for all humans, and I call it a cognitive bottleneck. So there are definitely skills which we can't broaden more, and AI will always excel over the humans. And this is, for example, assessing the massive data sets, and this is where the radiologists will always, let's say, behind AI. But all the medical devices I was referring to are designed not for AI being independent rater of those images, but working together always. So we know from the data that if the machine learning model is used carefully, thoughtfully in the hands of radiologists, the overall accuracy, sensitivity, specificity is better than the case when the radiologist was working previously alone. This is what we know from the data, and there are no studies, maybe there are some pilot studies, but there are no official studies which would say that AI perform better than radiologists. And yes, it was said by, I think it was said by Geoffrey Hunt, who got the Nobel Prize this year. And this was, for me, it was a surprise that he got it, because I would say that in physics, it should be someone from the physics world to get this prize, to make the advance in, and again, I'm saying that we need more advance in the measurements of the data rather than on the analysis. So I'm not envying him to get this Nobel Prize, it's okay. But for example, this prediction that AI will make the radiologists redundant, I think he said it in 2015, and it's still not true after 10 years. So yeah, it says something that we need both humans and AI to make it.
So it will be a kind of an enhancement or a tool for radiologists to another source of information that he will integrate to make a clinical decision. You mean so? You cooperate with let's say, distinguished entrepreneur in this field,
Daniel
Kvak. Yes. So could you comment on the cooperation?
Hopefully, yeah. Daniel is a founder of one of the probably most successful AI startup in healthcare in Czech Republic, but they have already implementations of their care bots in many countries. And so this is an example where of a already certified medical device which is helping radiologists to overcome their cognitive bottlenecks. And the cooperation, we have two kinds of cooperation. He's at first he was a client of our company, so we were helping them to analyze the data to get the certification, and nearly at the same time we made a deal that he wanted to stop his PhD studies at the Faculty of Social Science and shift to the Faculty of Medicine. So he's now my PhD student at the Department of Simulation Medicine. So we have this kind of cooperation, but his research here at the Faculty of Medicine is shifted so he's not doing what he is doing for his business. Here he is researching really new topics in the field of generative AI. So yeah, he's exploring some methods for simulation or synthesization of data, image data, for making data sets more biased. Because bias in the data is something which is kind of liability of researchers for today. So this is a very exciting topic, I would say.
Yeah. So fingers crossed. Yeah. So
for him,
for him, you mentioned simulation. So let's move to another part of your life, and this is the implementation of the innovations in medical education. So it was your, let's say, job in the Institute of Biostatistics and Analysis, and you are one of the founders of MEFANET conference. Is it? Am I correct?
Yeah, you are correct. Yeah. So when I started the job at the Faculty of Medicine, or at in the time Center of Biostatistics and Analysis, I was mainly working on projects of faculty development. So projects focused on technology-enhanced learning, e-learning platforms, and those kind of things. Later, I found my own topic, which was and still is virtual patients, so kind of simulation. We call it low-fidelity simulation for medical education, which is still my passion in terms of medical education. And with all the outcomes from the projects which I had, which I was part of, or later also which I led. So with these outcomes, I then knocked on the door of this Department of the Simulation Medicine, and I got position of garant of one of the subjects here, which is called Theoretical Basis of Clinical Medicine. The subject was founded much more earlier to harmonize transition between the theoretical parts of the curriculum to the more practical clinical parts of the curriculum. So for the students of the fourth year, we are making them face a virtual patients from different fields. And yes, this is a kind of simulation without the patient mannequins. So we just simulate the situation and simulate, let's say, clinical reasoning, some thinking processes, decision making, critical thinking, and those kinds of skills which they need, I think, which they need for their later career, but they need it also before entering clinical sites for the later education.
Yeah.
So what we are hearing from the clinicians is that students, thanks to not to this subject only, but to the simulation medicine implemented now in the faculty, so they are entering the clinical education like more prepared, better prepared.
They know what
than before.
Yeah, how to solve the clinical situations. I remember that that you were in London and you really got inspired there in St. Edward's, or no?
No, it's St. George's University. St. George's University.
Comment on the curriculum and what got you inspired there.
Yeah, St. George's University in London. It was a university which was in fact a partner in all our projects. At first, they were the leaders. Later, we overtook, but still the people there were a very precious asset for us. It's a private, small university, completely integrated into a hospital, and their curriculum is completely based on a PBL method of tuition. So from the first year, everything, or the most important means of teaching is problem-based learning. And I visited the university many times, and I really liked how students were learning in the university, in the class, not at home, but in the class. So most of our projects were delivering this kind of skills. I mean, the PBL tutoring at first, and later we were transitioning to TBL, team-based learning. So, and everything was always connected with virtual patients as application exercises for this kind of methods.
Could you give us an example? How does it look there?
Okay, so what I'm not sure how does it look like it today, but around 10 years ago, when I visited it for the first time, the students were working in groups of 10 to 12 people. The class was facilitated or led by a PBL tutor who was not always a medical doctor. That I found somehow interesting, because I also don't have the medical background, right? So I was exploring how these people with an economic background or whatever background in chemistry or were facilitating or leading the group of students exploring some medical or clinical case. And in fact, one clinical case which were they exploring, it took them 1 week. So, for example, on Monday they were faced to the patient. So there was some kind of visit of the patient or his or her family to a first contact with the healthcare. And they needed to explore what was the symptom, was the problem. So during the first day, they could get to some, let's say, description of the situation and maybe take some anamnestic data. And at every step, they were asked to develop their own learning objectives, their own learning outcomes for the future. What do you need to know to explore this more? Are you aware of breathing? Yes, we are. But do you know how the breathing is done in the blood? No, we don't know. So this is something you should study. And accidentally, by a good accident, these kind of for example, lectures on these topics were in the curriculum for that week. So somebody clever who created the curriculum complemented the PBL session with the theoretical sessions, which were tailored to the cases. So this was also a new thing for me.
Let me clarify that they started with a clinical presentation. They need to find out what's the problem and what they need to know to be able to solve the problem. Yeah, and so they didn't have a, let's say, a formalized course of anatomy, histology, physiology, whatever. And from the start, they had the clinical presentation, and these were the incentives to learn relevant anatomy, relevant physiology, pathology, etc. Yeah.
And then they had lectures by experts of anatomy, but only for the topic which were they exploring. So for the clinical case, relevant for the clinical case, and a lot of self-study. In between of the week, and by the end of the week, they were able to finish the clinical case. Of course, with a kind of detail during the first year, finer details in the next and next.
Yeah, it was elaborated during the course of
study.
So
they called it kind of a spiral curriculum. So there were always deeper and deeper, finer details of what they were able to absorb.
Were they able to have a feedback from, let's say, the clinical partners, how their student made it in the real life? Because this is a completely restructuring of the way how we teach medicine here.
I'm quite sure that they got it at least during their residency. And somehow I feel that in UK they don't think that after finishing the medical school they are the doctors.
Yeah.
So they're starting to get the residency, and this is for them the time for getting this feedback.
Yeah. Okay.
I think it's also very similar to here, but much more pronounced there. So the residency is the part of the clinical education.
So this is something that you tried to implement here, yeah?
Not the whole
Not
concept.
the whole,
Not the whole concept. That would be stupid idea of mine. And also, I saw the limitations. At first, I was there alone. Later, I took some colleagues from here and clinicians who gave me some perspectives of why this approach is also. It has also cons. So I don't say today that this is something which we can assess as the best. But what we try is to get the advantages of it. So mainly the clinical reasoning skills, virtual patients, and we try to put it into our culture, into our curriculum, and we didn't make a revolution, but I think that putting it into the right here, and for me at first it was quite late, fourth year of education, because I saw it from the first week at St. George's, but today I think that it was a reasonable approach.
Yeah, from my point of view, this definitely helps to develop clinical reasoning. So this is a very handy approach, the TBL or PBL approach. I really like it, and I thank you that you brought it here, or helped brought it here. So what's the next? Where is the field moving? Is it over your work in this field, or this kind of future, or?
So from the point of the methodology of teaching, we made together, I mean with St. George's, we made together a step from PBL to TBL. So this was a big movement, and it still is moving in the world from, so where at universities where they already implemented problem-based learning, case-based learning, they are now moving towards team-based learning, because there is the data that it's more efficient in terms of the academics involved, in terms of resources, without compromising the quality too much. So, for example, we didn't bother too much about PBL because we saw that it's too resource demanding. So we did a TBL, and and I still think we can move forward. So I have some small objectives in the subject I am guaranteeing. For example, there's one phase of learning which is self-study, pre-class reading materials. I don't think that reading material is a good way of learning. I don't practice it myself. So I think that there are already better ways of learn. If you want to learn a language, you would probably install a Duolingo in your smartphone. So I'm thinking about these kinds of new approaches also to the pre-class reading, pre-class preparation. Don't have to be always reading. And there is also, and this was an inspiration from my last contact with a PhD student in UK, Jason Lawson, who came here to the Simulation Center or to the Department of Simulation Medicine to give a lecture. And from his experience, since he has shared his experience with his own learning, I started to think about change in the pre-class reading, because he had a disability in learning. He couldn't learn from reading, and nowadays he's a leading young clinician in surgery, kind of surgery. So I think that our system is not, for example, prepared for that kind of tailoring the education to the needs of people who have problems, who have, we call it special needs in learning. There are a lot of people, and we can see from the example of him that they can be very good doctors and still can have problems in getting information from a written text.
So you are talking about kind of multimedia, but when we speak about multimedia, we imagine a lecture, a pre-recorded lecture that some talking head is giving a lecture. So I think that you mean something else. You mean some structured material, interactive material.
Yeah, I'm not sure. I just know that it has to be explored, and and I assess this as a weakest concept of TBL. There are also other ideas which I would like to implement later. For example, in the virtual patients, there are low fidelity. It's okay, but I think that even with this low fidelity simulation, we can present them better than just text and images. So we also work on that. It will take some time, but you asked whether I see kind of progress there, and yes, there are things to be explored and upgraded.
Perfect. So your work is not finished here in this field. So
I hope that not.
So let's move to another part, and this is your spin-off. So you have a lot of activities in the research and in innovation in teaching. So you still have energy and time to enter the data science and data business. So could you comment on that? So how it happened and how it's going on?
Yeah. So in 2014. At the Institute of Biostatistics and Analysis at the Masaryk University. It was a department of Masaryk University, and we had a lot of projects coming from industry. So there was an idea of the university and also of the people at the institute of creating a spin-off. In that time, it was the second spin-off of Masaryk University. And I was lucky to get the share of that company, and also the accountability. So it changed my view on the responsibility, and I had to shift the responsibility into accountability. So
what's the difference?
The difference is that at academia, at the university, I can be responsible for projects. Anyway, in the business, I'm accountable for everything which is coming out from the company, and sometimes it's positive, then it's okay, but you have to be accountable also for the negatives, and accountability is something which you can't share that much. You can be one or two partners, and whereas responsibility can be shared around the teamwork. So this is the main difference. As I feel it.
So it's a huge burden.
It's a burden. You have to somehow adapt to take it. It was not easy for me, but I am now very lucky that I could try it.
And what was the thing you had to adapt? What you need to change in your setting or?
Maybe I can give you some example. In earlier stages of my career, I was always very unlucky when, for example, a PhD student departed or a key member of a team departed. Later, I had to internalize the concept that work is not a marriage. And that you have to be adaptable to new situation, and that it's always you, I mean, me in that position, again, who is accountable and who has to adapt. So if you asked what was the thing, I think it's a skill of adaptation to new situation. So you plan something, you develop your plans, you develop your products, and there are changes you can't stop, you can't avoid, and you have always to adapt to these changes. So maybe this I would express as something which I didn't have, and now I think I have.
And the business of your spin-off is in data. So can you
the name
explain what does it mean?
The name is Institute of Biostatistics and Analysis. So from the name you can feel that it's mainly about data analysis. In fact, our vision is healthy data, and we are helping investigators, researchers to organize projects, clinical research projects, mainly interventional clinical studies, patient registries, but also classical clinical trials. And we are offering services of clinical data collection management, mainly the clinical data management and analysis, including all the regulatory steps from writing the protocols, applying for ethical committees, doing the data reviews, until even medical writing of the papers.
So it means you provide an information system for data storage analysis, and the system needs to comply with regulation in clinical trials, etc., etc. Yes.
Yeah, we're providing the system in that part of the business. We also, from the start, we decided to develop our own system. So what I would like to see in the future, in a very close future, is that we will not only sell our services in clinical research, but we will also, let's say, shift towards product-based offerings. So nowadays we already have a product which is its trademark and which is used by other companies in clinical research. The name is CLADA-IS, and it's an electronic data capture system which can be used for clinical data management. It has also already some industry-specific certifications. We are providing this system, but not only for our projects of clinical research, but also for other companies, other research groups, even for universities.
And I wanted to ask you if it was a smart move to go into the spin-off, but I won't ask that. I want to ask you another thing. It would be too bold a question. I think that you do it the hard way, the spin-off, when you are really involved in management of the company, and usually when there's talk about how the spin-off should be set up, so the researcher brings in the idea, and then you have to hire a CEO that will run the company. So how do you manage to do that?
We did kind of our journey. I don't think it's the best idea to follow our case. Anyway, I would say it's successful, but we had our ups and downs. So the approach you mentioned, it's kind of classical approach, which we didn't, I don't know why, followed. So we as researcher were trying to manage everything at the company. Later we hired COO for a particular period of time. It helped, but it had also some kind of disadvantages. So now again we are still two partners plus Masaryk University there in the management. The top management. Anyway, we have a very good team of middle management, which I really value, and this kind of structure is helping us to move forwards. Your suggestion to hire a CEO or a COO from the start, it's if I have to make another spin-off, I would definitely contemplate or consider this kind of approach. It may be good, at least for the initial years. What helped us was the South Moravian Innovation Center, because they helped us to develop skills which we didn't have for running business. So there were experts, or let's say successful entrepreneurs, who were open to discuss with us our problems, and I think it helped us a lot.
Yeah, one of the distinctions between the success of the US and Europe is interpreted in the lack of spin-offs and businesses that start from the universities. So what do you think is the main hurdle or main bottleneck that we don't go this way to start a research and then go the business way?
I think this is the overall society. We are not that business-based in Europe as in US. But what I have seen recently here, for example, at Masaryk University, is a lot of spin-offs coming out from the university. So there are already the mechanisms settled. I would say, just from what I'm seeing, I'm sure there are still some hurdles, but there is always hurdles. There is always challenges you have to manage. So nothing happens like this. So if we managed 10 years ago without mechanism settled, I think nowadays it should be very easy to build on the experience of all the previous spin-offs. And if anyone here wants to start the entrepreneurship, go ahead, because here at Masaryk University, I think we have good procedures, and also the attitude, I think, for creating spin-offs is good. One example from my recent, I did a lecture at another university, and I mentioned spin-off, and guys from the management of that faculty came to discuss things, and from what they were pronounced, the questions, I felt that Masaryk University is very advanced in this field, because
good news.
Because they were asking questions which I wouldn't even think about, like, for example, how was my or our deal with the university to use or not use students. So in other words, they are contemplating or considering option to not allow students to work as a spin-off of that university, or to somehow limit, to govern. This is, for me, that was really strange. Strange discussion.
Yeah. So this is good news that the Masaryk University has got better ideas about that. What does it mean for you to go to the spin-off way? Because I would say, as a researcher, I love research, I love academia. Starting a spin-off means let's forget my academic life and my research and just devote my time to business. Does it mean that when I want to start a spin-off, that I end my academic career?
So from my example, it doesn't have to be like that, because from the start, my aim was to maintain also the academic part of the career. It wasn't the easiest way. Anyway, it was possible. Today I'm trying to get a 50-50 balance. Sometimes it's more university, sometimes it's more business. but you don't have to
abandon
or jeopardize everything you did at the research. So,
Uh-huh.
and for me it was tempting because already during the PhD studies I was working in the industry. So I always found I love academia, but I found it insufficient for myself. So when this opportunity was there, I took it. And you love research. I love bridging research and business-driven solutions.
Yeah. So this is good news that you don't have to abandon your what you like. Actually, what is the goal of a spin-off? What sometimes people talk about a life cycle of a spin-off, that you use it to develop an idea to let's say a higher degree and then sell the company to cash out and then do something else. It seems that you did it a different way, that you started a long-term business.
Yes, we started a long-term business. It doesn't have to be like these templates that you just make a spin-off and find an investor and sell it and make an exit. Exit is always an option if you do a business, but yeah, as you said, you can do also a long-term business, develop some new qualities, be with the people for a long time. It also has some values. So yeah, we are not driven by the idea of selling the company after 3 years. This is the idea of the startups. We have never been in a situation of a startup.
Oh yeah.
Because from the beginning, when we began, we had a lot of employees, too many employees.
Okay.
So we had different challenges than startups. Yeah, so
this is a distinction, startup and a spin-off. Okay.
Sometimes it's very similar, but in our case, it wasn't like that because we had the history. We had already the business history. We were the team working here at Masaryk University who naturally went to the industry. So it wasn't something very new. We even kept the same name. So.
Okay.
It was really a little bit different than startups.
Perfect. So then I'm afraid that our time is running out, so I would just like to go through the questions that came through the registration process. So where to start? Where's the number one? Yeah. Lenka Součková, I want to ask you, what's your greatest scientific achievement that you respect the most, and what will you do in 10 years? Just a short answer, yeah?
Greatest achievement, what I value most is when I supervise a PhD student and he or she takes it to the completion. So
nice.
seeing them finishing the doctoral study is something rewarding.
10 years.
In 10 years, I would like to sit in the audience and listening to another guest you are questioning. And
is it a torture, you mean?
No, it's not. I would like to enjoy it there. I was there many times before this, so I know it's okay. And I hope that there will be kind of progress from my side. I'm aiming to progress more and more. And I hope that I'll still be in the dual role, continuing to bridge the academia and business.
Perfect. Jan Trajelinek wants to ask you, what's the best way to balance knowledge in IT and medicine?
Yeah, so first of all, my background is biomedical engineering, which is quite away from IT. Anyway, I'm doing IT a lot today. The medicine is even worse in meaning of my limitation of my background. So how to balance knowledge in IT and medicine if my background is not IT and not medicine. It's difficult to answer. So I would say it's important to select the important information and to neglect the details. At the same time, I'm not saying that it's good always skimming the surface. I still do activities where I dive deeply into some topic.
Yes, the first question from Tomáš Kašpárek, I think we already covered, but how did the spin-off change your life? And do you more science or business, and what do you like better? Could you?
I will only summarize that more science or business. In terms of academia and business, I'm trying to do 50-50. Anyway, at academia, there is little space for science, and you must know it better than me. So I think that maybe I'm doing more business, even if I'm trying to get 50-50. And how spin-off changed my life, I don't know. How would my life be without the spin-off? Maybe still I would say that it changed my feeling of the responsibility to accountability. It's still something which I'm thinking about when I'm driving a car, for example.
Wow. So it's a change.
Yeah.
Okay. About the role of AI and replacing humans, we already spoke about, but still the question, is there a field where there's no way for AI to replace humans? What do you think about that?
AI is a great tool, great asset. We already see also kind of creativity. I think we can say that AI can simulate creativity. But what I think will not replace humans is empathy. This is some quality of humans which can't be, which is irreplaceable. So in terms of healthcare, we can see that AI or robots or voice bots will perform better in scheduling, rescheduling patients, which can give more space for nurses to care about the patients. The care, the empathy is something which I think is is AI not able to replace.
I'm not so sure. From my point of view, what I see in my field, that this might be also something that AI can at least mimic, that you cannot distinguish, simulate. Yeah. So from the human perspective, you get accustomed that this is not a human, but something that behaves like a human, and you accept that there might be a good acceptance of this. Okay, where you see IBA spin-off in 5 years, so I don't know if you can share your business plan here, but...
In general terms, in 5 years, that's not that long term. So we have, for 5 years, you have to have your plans. So there is a plan to be in constant financial growth. This is important to achieve every year. And to achieve that, our strategy is to shift from the service-based offerings to the product-based offerings. This is the shift, the challenge which we would like to take and fulfill. So in 5 years, if there are some research groups, companies, whatever, who are using our products and not only our services, that would be a good to see.
So good luck in that. Okay. Kristina Šmardová wants to ask you, what was the biggest challenge in your journey?
Again, those moments connected with the departures of key persons from of the company or even the PhD students sometimes. I had some plans and it changed with the departures, but yeah, so the biggest challenge is to adapt to sudden changes.
And you made it. When should AI be specifically questioned in terms of reporting research results? Rich Zimmerman asked that. I'm not sure if I understand the question, so please give examples of artificial intelligence use being both an asset and a liability for researchers. So
AI as asset and liability. AI, machine learning is a great asset in hands of researcher, but it brings also some liabilities. We already touched on something. So if we want to use AI to assess massive data sets, it's fine, but we need to assure, so this is our liability, we need to assure that the data sets are diverse. So the training data are diverse enough, they are not biased. Otherwise, we will get skewed results, bad or incorrect conclusions. And we already see some examples of that. So that's one liability is the bias, to reduce the bias, cope with that. Another one, maybe sometimes we think that the deep neural network is so sophisticated that the result must be correct. So over trusting AI can be also, let's say, malpractice, and maybe we can talk about this also as kind of liability for research.
I think this is a danger in the future to rely on that too
but
much.
But there are some movements against this. We call it the explainable AI. So there's AI Act brings the explainability condition. So the society knows that this can be a problem. So we already cope with that. You have to have an explainable model if you want to get the certification. Not now, but when the AI Act is implemented.
And explainability means that you can review the ways the results were generated, or
for me, explainability is, for example, when we together made a model which was able to classify between schizophrenia patients and healthy controls. And with our models, which were based on some linear algorithms, we were able to project back the predictors, regressors into the image. So the medical doctor, you clinician, could interpret, comment on that, and take in also some medical knowledge. This is something which is very difficult to achieve when you have a deep neural network, but the society is not saying that it's not, if it is hard to achieve, that it's not possible. So we have to make the models still explainable.
And this is an important notion, and just to extend your example, one of the best distinguishers between patients and health people might be just a higher amount of noise in the images because of the restlessness during the scanning, etc. So this is not what you are looking for when you try to find out the signal in the image, and that you base your conclusion or decision out of noise and not out of fact or process or signal or something like that. So it makes sense. Thank you very much. Well, so we covered the question from the registration. Is there anything that you would like to ask or comment from the audience? Yeah.
Just regarding the problem-based learning approach, how does the exam look like? I mean, after the...
This was one of the biggest challenges, and we learned a lot during the first year, because when I was doing the projects, all the students were always voluntary. So we tested PBL, TBL. We had our evening lessons of TBL, and we tested the content, and the attitudes of students were very nice. Once we implemented into the compulsory subject, and the faculty needs some summative assessment, not just the formative, it made a big difference, much bigger than I expected. So I must admit that my first solutions were not clever. And today, so how you can do it, because we want students to take their learning into the class. So we have some checklists, we have some observers, and they are assessing the students' activity during the class. I mean, the PBL or TBL session. And you don't have to have one exam at the end. Mm-hmm. You can have several exams, smaller, and somehow mix all the components to final grade.
Mm-hmm. So basically, you can't compare whether the PBL is better than the usual, because you don't have like an objective that to judge. Right. I mean, I like the PBL, but like, how do you check? Because the process of PBL is clear. Because then, you know, if you want to learn something, it's much easier than if someone tells you. But in the end, like, how do you prove that you really teach something the students?
Oh, we didn't undertake such a study. What we did, what was achievable, we did a multi-institutional comparison between PBL and TBL, because we were like choosing between these methods, and we were assessing students' and teachers' attitudes. So this is not what you are suggesting, to make some pre and post tests and compare the knowledge or the skills or the performance. Anyway, there are studies which shows that performance in certain skills are better achieved with this collaborative learning methods than with the standard way of teaching.
Mm-hmm. Okay, any other question? Rich, please.
Following up on AI, it's going to be big business. People like Elon Musk and Jeff Bezos will get involved. So, in terms of your comment on bias in AI, how can a layperson assess bias, and what can be done about it?
I think this is the liability of the researcher, or if you because you uncovered also the business of it. So Elon Musk must be accountable for bias in the training data he is using. And what we saw, I think, last week, for example, it was not in AI, but he got the prize. It's called Rusty Razor from the society, like we have a skeptic society, I think in the UK, because sometimes he's doing things like X network. He destroyed Twitter, which was a nice network with a good information there, and now we have X network with a lot of bullshit. So a lot of, let's say, bias in his own data. What can we do about it? We have to be careful about bias. I think that we touched maybe on mainly on the research. The researchers who are using AI are aware of the problems of bias, and I think that it will also come to the business, and the businesses which will be aware will be the successful, which won't be aware will hopefully be unsuccessful.
Okay. This is a very general question and a topic for a long discussion. So thank you for asking your questions. Thank you for trying to answer that. Well, I think think we are done. No more questions. So I thank you very much, Dan, that you went through that.
For being put on me.
I thank you for coming and meeting us, and I thank Martina Vrablíková for making it happen, for the support, and looking for another meeting in December. What will be the topic? On biobanking. Yeah.
But also the Center for Precision Medicine.
Perfect. So, looking forward. Have a nice day.
Thank you. Thank you.